Hi, I'm Ruanne Brell, Senior Legal Advisor at Avant. Today, joining me is Dr. Michael Wright, Avant's Chief Medical Officer. Hi, Michael.
Hi, Ruanne.
Thanks so much for coming along. At Avant, we know that Medicare and the rules and requirements associated with it can be complex for our members to understand. We look at some of the top questions our members ask us about Medicare and what you need to know. In this episode, we're going to talk about time requirements and how these work for certain item numbers. So, Michael, some consultation services have a minimum time component in addition to clinical complexity components. The first question we get asked a lot is, does the patient have to be in the room with you the whole time?
The simple answer is yes. For a personal attendance, only the time spent face-to-face with the patient can be claimed in relation to a Medicare benefit. And this also applies to telehealth consults, so appointments over the telephone or over the video. Only the time the patient is actually on the telephone or in the video call can be counted towards the minimum time component.
So how do we look at what can and can't be included in those timed consultation items?
Only the time spent dealing with the patient's health condition, which the MBS says is the patient requiring active attention, can be counted towards the minimum time requirement. There might be cases in which additional time is required for a particular patient, which might not be evident from the clinical content due to other complexity of the patient. But it's important that doctors write down this additional component, such as where the particular patient requires more time because they have an impairment or where they may require an interpreter to communicate. The time required to treat the patient under those circumstances can be claimed if the patient's circumstance adds to the clinical complexity, as long as the records reflect why more time was required.
So I suppose underpinning all that is basically, if it pays more, Medicare expect more time and more effort from the doctor.
Yes, you're right, Ruanne. It's not just about the time component, it's also about complexity. So the more time you spend with the patient, it's also thought that there should be more complexity needed to be documented. So it's really important to record in the consultation notes what you've done, particularly action that's required, which might justify a particular item number, even though the time that you need to take to do this may not be claimable if the patient's already left the room. Remember, if you're audited, the record will need to show why you took the time you required for the consultation, and you also should have a consistent and reliable method of recording the actual time you spend with them.
So, Michael, how do you do that in your practice?
So in my practice, my electronic medical records has a timer that times how long a patient's been in the room. I'm lucky in my system, I need to close that consultation in order to bill a patient. So that gives me an accurate record of when the patient leaves the room to when they get to the front desk. So I get a good record. The other way that I've used in other practices is actually to record in my consultation notes the length of the consultation. And as I've mentioned before, it's important to document the complexity of the case as well.
And that's a good tip for our members so they don't rely on the patient record being open, because that might be open on the screen for some time.
Yeah, you could open it up and look in someone's chart for 2 hours, but it doesn't actually mean the patient's been there for that time. So I don't think members should rely on that.
That's a great tip. Thanks, Michael. And thanks so much for joining us. So remember to look out for some of the other episodes in this series where we look at the ins and outs of Medicare billing and compliance.